Let's stay in the health sector. Now, one of Ghana's most outstanding nurses has received the Lifetime Achievement Award for nurses taking care of children with cancer in Africa. 49-year-old Enyo Asi Mosompra has dedicated nearly 20 years of her life looking after children with cancer at the Kolebu Teaching Hospital right here in Accra. Caring for a condition that costs so much to treat and yet so poorly funded in Ghana, Enyo has found strength under very tough conditions. JoyNews' Justice Baidu went to meet her.
This is one of Kolebu's most important wards, the cancer unit for children.
Let's check Isaac's chemotherapy before his checkup.
It is here that Enyo Asi Mosompra has spent almost 2 decades of her nursing career trying to help children with cancer, almost standing on the borderline between life and death, survive.
I wake up and I come to see the children that I thought yesterday were dying, now happily playing around, chatting, and then their parents happy. That's what gives me motivation.
In here, young children, toddlers to those almost in their teens, many in bandages, some with swollen limbs, and others barely able to breathe.
In Ghana, we are supposed to see like 1,000 children with cancer every year. But our place being the biggest treatment center, we see close to 300. And that is like less than half of the number that we are expected to see. So a lot of children are in the communities dying because of a lot of myths. People do not have any information about childhood cancer. I had an auntie who was a nurse, and she was doing the nursing in a rural community. Sometimes in the middle of the night, they call her, and she has to get up. She can stay with the patient throughout 24 hours if there need be. So her commitment to her work is what really encouraged me to want to be like her.
Treating cancer in children could cost as much as 30,000 cedis and over, and yet it is not covered under the National Health Insurance Scheme. Medics like Asi have sometimes had to watch patients die. Her award, she says, means a lot, and she hopes goes to spur her on to do even more.
It means so much for me because it's like I wake up every day, I come to work, I am seeing the children, but nobody really cares about what we have been doing. I'm not alone in this. A lot of nurses, doctors, pharmacists, we are doing so much. But for somebody or an organization as big as SIOP to recognize my work, it gives me so much joy. I'm so proud. No money can actually pay for this kind of honor than me.
And that this also goes to show that for any health worker who truly gives her job her all, there could indeed be a big light at the end of the tunnel. Justice Baidu, JoyNews, Accra.